right, let's call to order the Human Services meeting for February 4th, 2025. All the supervisors are here except Julia Robinson, who is excused. We have Jesus Castro from Youth and Governance. However, Olivia Parrish, Aksasad Kadri, and Shri Harsha Sitamaraju are absent. Okay. Any citizen comments? Do we have any citizen comments? No citizen comments? Okay, citizen comments are closed. Do we have any supervisor comments? I don't have any particular to offer at the moment, but anyone else want to update on anything? You mean, no? Okay. Move on. We need to approve the minutes from the last meeting, the January 7th meeting. I assume those of you here, you had a chance to look over the minutes. Are there any corrections, amendments, changes to the minutes from January 7th? Everything looked good? Okay, we have first by Supervisor Nez, a second by Supervisor Kirby. Youth and Governance? Aye, okay. Committee?
Aye. Yeah, felt it out.
Any? No? Motion is approved. The minutes from January 2nd are approved. Okay. Tonight we're going to have an overview of the DHS dashboard by Katie Hanks.
So I'd like to introduce Katie. She is our Human Service Quality Analyst, began the position in January. Prior to that was working in a number of programs, specifically our Comprehensive Community Service Program, overseeing the administration of that. And one of our goals this year was to get something out there that's a snapshot of the various divisions without overwhelming people of all the data we have. So Katie's going to go over that with you today. If you have the copy that's on the table is the most recent version, the one you got emailed to you. There's been a few corrections made to that. If you have other ideas or suggestions you'd like to see in the future, we'd be happy to do that. If you want to get into a deeper data dive, we can do that at a future meeting also, but I'll turn it over to Katie.
Quite the introduction. It's a whole spiel. So I guess I'll just kind of walk through the dashboard. This is representing each of the divisions in Human Services. They're all accounted for with just a beginning look at what we thought might be important information that you and the community might want to know about. So looking at the Division of Aging and Disability, we have different services provided. We've got rides, and in this chart you'll see that 2024 is the yellow and 2023 is the blue. Rides provided can be a slew of rides, one-way trips through Western Kenosha, paratransit, regional, different things like that. Meals Served is our Meals on Wheels program and our senior dining and the collegiate and carry-out meals as well. So that's that. APS cases, this is Adult Protective Services, cases that were opened through the division. And then we have Resource Center contacts, duplicated and unduplicated. So duplicated, of course, can be the same people coming back for various reasons. So that's aging and disability. Any questions, comment? Yes.
Yes, I do. You have Resource Center contacts duplicated and then Resource Center contacts unduplicated. Are the unduplicated like not in the duplicated ones at all? So they would, or are they separate completely?
Multiple times in the duplicated.
Okay, so these are separate, done
Correct.
at once, but they're not in duplicated at all. Okay,
Correct.
got it. Thank you. Good thought.
I also have a question.
Yes.
How do you explain the pretty sizable drop in meals served too? I'm just curious. Is there a reason for that?
Yeah, actually, yes. So we had some money that we received via some COVID dollars that we were able to expand our nutrition during 2023. Those services came part of 2024 and then the services ended. So we scaled back quite a bit knowing that was coming and tried to reprioritize who was getting things. We were doing a lot of things like food boxes, shelf stable food boxes. those folks we worked with to get their food boxes from the Shalom Center or from the Sharing Center. But there was a lot of duplication of nutrition during the COVID times, and this is just kind of scaling it back.
Okay. All right, thank you.
Then moving on to health. We have the Corey clients visited. This is any overdose survivors where the client was seen by the Corey team. We have people trained in Narcan use. And this is everyone that was trained.
Can I ask a question on that?
You betcha.
So the 2,216 that were trained in 2023, in 2024, that's an additional 1,525?
That's
Terrific.
correct.
Okay, thank you.
Environmental and technical assistance, calls and emails. This can include questions about mold, housing, licenses, things like that. Some complaints could be included in that as well. We have total clinic patients. This is an unduplicated number of people that were seen at the clinic. And then clinic visits, which those patients can be duplicated then with visits. So clients returning to the health department for additional services or repeat services. Yes.
So I have a question on the environmental technical assistance calls and emails. That's a pretty significant drop. Do we know what the driver is? Are we doing something better so that we aren't getting those calls?
I wish that was the answer. What happened was there were a couple of months where there was a reorganization and data got lost.
Okay.
So that's for that. Any other questions on health? All right, so moving on to the workforce development and child support. We have the WKRP calls received. This is calls in the region. So this would be Racine and Kenosha. We have Medicaid recipients, which both Medicaid recipients and food share recipients are clients, not cases. So we could be serving 5 or 6 clients within one case. So that is that information. And then our call center rate is the answer rate from the calls that were received. Now, some things that contribute to this is vacancies in staff. And Kenosha calls don't get just answered by Kenosha people. So if Racine's short on staff, which they were a little more significantly down on staff than we were, then our answer rate kind of goes down. And what happens with those calls when they aren't answered is typically they hang up and call back. So you'll see another call.
That's what I was gonna ask. So these are calls that haven't been answered. Okay, so what happens?
Yep, they hang up and call back.
Is there any way of determining that?
We can find.
You could ask, hey, did you try calling and no one answered?
There is a
So we can-
callback feature that you can leave on that. So if you're on hold for 25, 30 minutes and you can put in your number and then you'll be put back in the queue. So somebody would get back to you.
Right.
So I think there's a way to measure that. And they grab all this data statewide. So we'll take a look at that. And see.
Yeah, because I think that would benefit us in trying to determine, the proper staffing levels and what we need for
Absolutely.
backup and all that. So,
Mhm.
okay, thank you.
Reading, other areas of data that you think would be more applicable, or more, the community would prefer? You guys would let Katie know, because we certainly can add to this. We can subtract from it. We can modify it. We're kind of open to suggestions at this point, since it's our
Very.
first shot.
If you think of things later too, at any point in time, you can reach out and we can put it on a list. And then we get over to the child support section. This is the child support collections collected, any money collected with where child support was involved. And hearings attended. This is any court hearings that the child support team attended. This could be on health insurance orders. This could be on a modification. It could be on a whole slew of things, even special appearances.
This is all court ordered,
Correct.
so that we had more hearings attended in
Mhm.
24 than over 23, but less child support collections. Do we have a higher bank, if you will, of unpaid child support that I'm not sure how that works.
I actually have a note on why the money decreased. So the reason that the collections decreased from 23 to 24 is that there was an increase in shared placements. So then there would be less child support orders.
So a family is shifting, mom has 50%, dad has 50%.
Got it.
There's sometimes not a child support.
Okay.
And our courts have really shifted toward.
So even though there was a hearing, it doesn't mean that there, got it.
Exactly.
Yeah.
Everything else, anything else on this section? All right. Moving on to children and family services. This is the number of people served by unit. We have our ongoing families, ongoing children, CPS families. One thing that I want to point out when it comes to this is that there is some duplication between the CPS families and clients served and ongoing, because they'll walk in the door through CPS, our Child Protective Services unit, and then lots of times they get passed on to our ongoing unit for continued service. So there are 83 kids from the CPS unit that were also subsequently served by the ongoing unit.
I'm sorry, 86.
83. Other questions?
Do we know why we have such a large increase in this 2024 over 23? It looks like CPS is the only thing that went down. It looks like everything else is up.
Yeah, yeah.
I mean, do we have an indication of just more service, more people requiring services? Is that what we're looking at, or?
It
We're
really
off-
has to do with the number of calls that we get into our office, so more people maybe being aware or alert, schools getting back into full bore and getting more calls out of there. So that drives that number, and you'll see it, it can be in the 1300s one year and then the 1200s one year, it just bounces kind of.
So is it a matter of the words just not getting out to enough people who?
No, I think everybody who's a mandated reporter knows they're a mandated reporter. There's
Okay.
been a lot of education in that. So I just think it's just what people see at the time and decide, well, you looks disheveled. This is the 14th day. I'm gonna call it in and see what that means, and stuff like that. So
It's more self, I guess they don't feel they need to be in.
sometimes there's some of that. They make the judgment call without calling us, or they just say, I'm just gonna err on the side of which we say, just call us. We'll make the assessment and determine if it's something that needs to be.
Do we find those who maybe have waited longer than they should have require more services? When they do eventually come in?
I don't know if there's a direct correlation.
Okay.
I don't know, we don't track that, but I don't think historically, if somebody's had multiple referrals, then that generally means there's a number of things going on in that family
Right.
that need to be addressed, which
Yeah.
means you're putting more services into
Yeah.
that's for sure.
Yeah, for sure. Okay. All right, thank you.
Okay. Moving on. We have Brookside and Willowbrook, and we have their daily average census. And the lines here are representing our goal. And so Brookside's goal was 154. And so you can see that, and Willowbrook's capacity is 24, so close.
Brookside's capacity is 150.
Correct,
Not-
correct.
right.
You're right, yeah.
Well, I guess that would be a goal too.
True.
Ultimately.
Ultimately, that's the goal, yes.
Doing pretty darn good.
Mhm. Questions, comments? Okay, medical examiner, this one, we gave a few more years just so you can kind of see how that flows. This one moves kind of fluidly. There is a little bit of difficulty in reporting the data because it captures information from anything that the medical examiner has to look at. That could be, a death that occurred in another county that the medical examiner is involved with. Also, there's a significant delay between when the death is reported initially and when the case actually closes. So that you will see sometimes that vital records and the reports that we provide don't necessarily always match hand in hand.
Are these closed records or?
Yeah,
so-
these are
because these were
completed
counted,
document
that was
reports.
done in
Correct.
click one. Okay,
Correct.
thank you.
Mhm. Other questions on medical examiner?
Yeah, I have a question. So you said cases where the medical examiner would go to another county. When would that be? I know we have to identify cases that come to Kenosha County that aren't necessarily Kenosha County residents, but when would the medical examiner go to another county then?
So it can be anything that the medical examiner's office was involved in. That can be another county resident dying
Yeah,
in Kenosha, and then also our residents sometimes dying in another county where we would want to be involved in that.
Really?
That's rare. So
Oh,
if
rare,
somebody got in
yeah.
a car accident here and went up to the
Mhm.
walking in the hospital and passed away and we were part of that initial,
Investigation or
there
something?
might be something to check.
Okay, 'cause that- yeah, okay.
Or a child or something like that.
Gotcha.
The other situation where that kind of handles is any time a death occurs anywhere else and we are going to handle the cremation. That would also then be reported in our numbers.
Thank you.
Any other questions on medical examiner? All right, veteran services. So we're talking about the number of veterans served through phone calls into the division, out of the division. And then our walk-in services, you'll see that we reported 2024. We just started collecting data in 2024. So then this coming year, you'll be able to see it in a more comparable way so we'll have a whole year to compare with another whole year.
So, the 2024 isn't complete yet? The
24
data?
is complete, 23, we didn't have any collections for data. So you're not really seeing a number represented in 23 because we weren't collecting the data in 23. 24 is there.
It just says 23.
What is?
Oh, you're talking about walk-ins
Yep.
only?
Yep.
Oh, I'm sorry.
I'm
Because I was looking
sorry.
at the reduction in number of calls and I'm wondering,
Yes.
yeah, there was no walk-ins in 23, so it looks like we have less,
Yes.
services being used by veterans. Do we know why?
So the was, the PACT process had caused an uptick of all the advertising. I don't know if anybody saw it on the TV. There's lots of advertising to your benefits are gonna expire, you need to contact us, you need to contact us, and that's gonna end by. Well, that one didn't happen. It didn't end. They can still contact and make claims and such. But the other thing is they stopped advertising it that way. So calls went down because of that.
Got it. So in 2020, in past years, and we might not have all that information, were we seeing lower numbers again, or were they still pretty high?
Well, they
because were
spiked when the advertisements started, but before that they were lower.
Okay,
Mhm.
okay, thank you.
Mhm. Any other questions on veterans? All right.
Well, I'm sorry.
Oh,
How come
yes.
there's only how come the benefits isn't there for 24?
That's a great question. Thank you for that. We only get that full number once a year and we haven't received the total number for 2024 yet. I think April. Yes. So we'll be able to report that again at some point. Yes, it is.
From the state,
Yeah.
yeah, calculated, they provided to us at the end for the beginning of the second quarter.
All right. Last but not least, we have behavioral health. And this is one chart, the first chart on the left is your 2020, you're looking at 2023 emergency detention admissions by the type where they were placed or admitted, and 2024 on the other side. You'll see total admissions were pretty comparable, 202 to 206. And we did kind of bold and highlight the Winnebago category so that we had a goal to kind of to reduce that. And so I wanted to make sure that we pointed that out.
Yeah, behavioral health in Waukegan went way up. Like,
Yeah.
which looks like it took it out of, is that St. Luke's? No, what's the bigger one? I can't.
That's
WMHI?
Winnebago.
Yeah, so the gray is that Winnebago.
That
and
is Winnebago,
the-
okay.
The yellowish gold is the Lake Behavioral Health.
It's a dark blue.
So a lot of work went into utilizing Lake and
And I know in 2023, we just started to use it. It wasn't a full year.
exactly.
2024 is a full year. Do we see that going up and more of the Winnebago going down, or do we have?
We certainly hope that that will be the trend. we started using, Lake onboarding in April. I
Yeah.
believe it was April of 23. We had to make a series of different policy changes that really, moved the needle on how often we could use Winnebago. Then we got into a fiscal arrangement with Lake as well. So that number, that needle really started to move throughout the year. We certainly hope that we can continue to utilize Lake more often. And I don't want to just single out Lake. We hope to use all of our private
Sure.
hospitals more than using Winnebago, as it's the most restrictive hospital in the state of Wisconsin. Now, we're certainly always going to use Winnebago for various reasons, but
Is there a time where that's the primary place you need to put a certain particular behavioral person in a behavior situation?
it's level of dangerousness.
Okay,
It almost always comes down to level of dangerousness.
okay.
Yeah.
And that one handles those types of,
So we do have a policy currently that no matter what the presentation is at the chapter 51, that we do contact all the private hospitals first. We do expect crisis and the local emergency departments to follow that policy, knowing full well there are certain types of presentation that the private hospitals will give us a no answer, though we still make the call. now.
okay, so it's still, hey, we have a situation,
Yeah,
this is what we're seeing, and they make the decision.
yeah, we're trying to decide what hospital will
Right.
or will not take someone. We let that,
Okay.
the receiving hospital, they make that decision.
Okay, all right,
So we make sure everyone has the same opportunity.
okay. Thank you.
Any other questions on behavioral health?
Yes. Is this children and adults included in these numbers?
Yes,
Okay.
How about overall?
This is kind of a superficial question, but how do you decide, which like data visualization you use for which?
I randomly picked.
Cool.
Tried to make it
That's
look
been my
pretty.
experience as well. I thought you could provide a little bit of
Sorry, I
insight.
forgot. I was trying to make it look pretty.
No, and it does. So
Tried to
good
change
job.
it a little bit.
I just want to point out as well, at the bottom, there's a link. There is a lot more data that is captured by all of our divisions. It's a link back to each one of those divisions. So like behavioral health has its own dashboard that certainly has way more data on it. So we, obviously, this is an overview snapshot, but please check out the rest of the data if you're looking for a lot more information.
Very helpful information.
It is.
Yeah, very good.
Well done.
Thank you.
All right,
A fact to
thank you so
follow.
much. Okay, next, Carrie Foss is going to be talking about the GO presentation.
Go, Carrie.
go
Carrie.
Carrie. Go Carrie. Well, good evening, committee and youth and governance. I'm glad to be in front of you again this evening. So we want to talk about outreach, and I'm going to talk about how outreach it is handled in just the behavioral health division. Certainly, all of our other divisions do outreach, but this is simply to make sure we have an understanding of what we're doing in this division, and then John's going to follow up with some 25 outreach information as well. Yes?
Get that on.
I will be happy to.
Becky is gonna do that. The first handout is already what we have in the books for 2025. We have confirmed activity with Aurora Health Resources. And then our drug take back day, we have 2 events every year. That is set by at the national level. So the days and times, it's always the last Saturday and last October of each month from 10 to 2. So we follow those instructions. But as you see on March 18th and March 20th, we're going to do Human Services on the Go. Now, we did launch that in 2021 in response to COVID, right? And the unrest that experienced in 2020. We realized that our community needed a lot of outreach and a lot of services and information. But given what was happening in our community, we really couldn't rent a hall and expect everyone to come to us. So we took a look at baseline data. We first started with where are the majority of our opioid overdoses occurring? And then we took the 5 highest areas through a heat map. And then we also looked at that area to decide what other services would that community need, what that neighborhood would need. We reached out to community leaders, county board supervisors, and asked for folks to really vouch for us, right? Because a stranger is going to come into the community. We want the community to trust us. So we went all the way out to a senior mobile home out in Bristol. So we brought our ADRC to talk about dementia care. We partnered with also public health and made sure at that time we had COVID vaccines that we could bring out to the communities. And when we were in the uptown area, we made sure our lead abatement team was with us because of those are older homes. So we really customized our human services on the go to the neighborhood. And we're going to take another tactic when we did that in the summer. So we're going to take another tactic and have a winter edition. And this idea now is to bring together a lot of our different divisions and offer a full family systems experience. So we're going to have public health, behavioral health, the ADRC, and veterans. So we're not really wanting to target one specific demographic. We want to say, we want to address the needs of the entire family system. So we're going to try something different because that's the beauty of outreach. We have to continue to evolve and meet the needs of our community. So that's the newest portion of what's happening. You can see that there's some tentative dates for 2025. Those are activities that we have been attending for the last several years. We have every intention on doing that. When you go to the spreadsheet, and more dates will be offered. And when you go to the spreadsheet, I wanted to give you all a snapshot of what we did in 2024. So this is everything that behavioral health did for outreach for 2024. There were 53 different encounters for the year. There were 2 drug take-back days that had 4 locations. There was a national night out that had 4 locations. The Kenosha County Fair had 5 days. We had 1 rain out day. So we try to attend as many community events that are already scheduled, but we also try to organize some events as well as needed. So this is just, again, a snapshot of one division, and we wanted to set the stage because we're going to try something different in 2025 as well.
So one of Katie's other responsibilities, when we started the quality position, it was kind of a catch-all for all the things that we wanted to do. We wanted to do a dashboard. The other thing we wanted to do is we wanted to post a calendar on our website that's easily accessible for the community about all the outreach that the entire human services does. We found that you couldn't really find it anywhere. It was some people had it here and some people had it there. And although that was great, we really wanted this comprehensive calendar of all the outreach events. So Mr. Potente and our IT department have gotten us set up. We just did some training today so that all of our staff members will be able to input onto a calendar that will be on the front page of the Kenosha County website when you jump on. So that's our hope, is to kind of make ourselves a little more visible. All these events are great, but you have to know that they exist to attend. So we're doing everything that we can to sort of publish where we go. Certainly every division puts things out on Facebook. We do, flyers. Depending on where you're going is depending on where the advertisement goes. But this is just another way of capturing all of the outreach and activities that everybody is trying to do for the community.
Our goal is that the calendar will be live and published on Friday. So that
So there's a lot, as you can see, this is a lot of information just for one division, and now adding in especially public health and the ADRC as a lot of events that happen throughout the month.
And we're also doing a lot of partnerships. Like Carrie talked about human services on the go. When you have a division that's small, like our veterans office, their ability to do a lot of the comprehensive outreach is far different than Carrie's behavioral health division that has a specific outreach person. So cooperating together and collaborating together, we're finding that we're able to, this is our attempt to see if we can have a greater impact with more people represented and more people served by doing these larger community events.
Really don't ever want to miss the opportunity when someone wants to share their story, and they share their story and it's outside of your skill set. So you just don't want to ever miss that opportunity. And I think this gives us a better chance at this.
Sounds great.
Yeah.
no, this is great.
Go ahead, Supervisor Nardigan.
Oh, more of a personal thing. March 18th, you'll be at the Twin Lakes Library.
Yes, sir.
Say hi to my wife, who works there. The, veterans, you're talking about the veterans stuff out that way. I mean, there's a few of the different,
Legions?
legions. I mean, are you,
Yes.
I'm assuming we have information out there,
Yep,
the schools,
yep.
all that, prior to obviously it being there, not. Yeah, I wouldn't get too far ahead of time because people go, well, I thought that was this month. No, it's not till next month, but, so I mean, that's just part of all of that.
We are very blessed that Carrie has a wonderful outreach person in her division, so we're leaning on her heavily to do all of the outreach for this. So she will inundate the community with all of the
Okay.
information. You know, I will be honest with you, we do once a month, our veterans office is at the Twin Lakes
So,
VFW, yes,
Yeah.
and we just don't get a lot of traffic. And so we've struggled a lot with how do we reach that veteran population? So we're gonna try this event hoping that at a library, maybe people are more willing to come. But if anyone has any ideas on how we can reach out.
are you getting it to the churches and as well and all of that?
You know, what we find is we're missing the younger veteran. You know, we have a great rapport with a lot of our older veterans, but we are missing that younger veteran. So our veterans office is actually in the process of trying to get a list of recently discharged veterans so we can actually mail things to them. We've run into a little bit of snag with the VA. They really don't want to give us that information, but we're working on it. We ended up getting Styles office involved to kind of help us push a little bit to say,
Yeah.
you know, we're not trying to do anything inappropriate with this information. We just want to connect them so people know what their services, what's available to them, and we can connect them early. Because, you know, oftentimes we hear the
Connect them
story
before they get out.
or as they're getting out, because my understanding is they get some information, but you know, it's so overwhelming when you're.
No, I agree. I haven't gone through it, but I know John had, but I was the younger ones, and we just got to find out, what are they doing? Where are they hanging out? What's happening? And work that.
We're hoping that mailing is a good start to that, because if we can start connecting, perhaps we can pick their brains to give us some ideas how to move forward. Because a lot of times word of mouth in some of these more insulated communities is great. But, you know, we certainly, if anyone ever has any suggestions on ways we can outreach, we are open ears to whatever we can do.
Okay, thank you.
So any other questions about outreach with behavioral health? Certainly always open to suggestions and always available for your districts.
This is what you meant by go presentation. You're on the go.
Yes, yes.
Now I
We are
get it.
on the go.
I get it. Yeah, very good.
Yes, yes. Well, that was the idea. Certainly, I don't know how, 21 really gave us an opportunity to collaborate across divisions.
Yeah.
And that's what we wanted to make sure that we could market something that didn't pinpoint to one division, that it was just human services. So this is just our continued attempt to make sure that we're collaborating with all divisions and making sure everyone has the opportunity to learn about everything they're entitled to in our community.
Well done. Okay. Any other questions for Carrie? Okay, thank you, Carrie. Appreciate your presentation, information. We are done unless you have any further questions, comments? No? Sure. We have a first by Supervisor Brown, a second by Supervisor Nardigian. Youth and Government
I.
Committee?
Aye.
She said that a lot louder.
Motion carries. We are adjourned.